Welcome to the Prescription Drug Misuse Program presented by Buena Regional High School, Stanford and Rebel.
Okay, so this is a picture of words commonly used with the word opioids.
What are prescription drugs? A definition of a prescription is a doctor's order to a pharmacist that allows a patient to get a drug that is not available without such authorization. It includes instructions to the patient and on how to properly use the drug. A prescription drug is a drug that requires a doctor's prescription and must be obtained at a pharmacy.
90% of prescription drug addictions start in the teenage years. 1 in 6 teenagers admitted to taking prescription drugs to get high or change their mood.
What is a side effect? It is an undesirable result from taking a drug. Side effects can range from mild to uncomfortable to more severe. Over-the-counter drugs can have side effects as well, though not usually as severe as those for prescription drugs. Contraindicated means that there is a medical reason someone should not take a drug. Example, a person may be allergic to an ingredient, might have a condition that drug could worsen, may already be taking another drug that can mix in the wrong way with the new medicine.
A point to make. Prescription drugs are designed to treat certain conditions and are to be taken only by people who have had them prescribed by a doctor.
When deciding the dosage, duration, and type of medication to prescribe, doctors factor in many criteria about the person for whom they are prescribing, such as weight, gender, age, allergies, and other medications that they could already be taking.
Taking prescription medications under a doctor's supervision is considered safe because the doctor will know whether a drug is contraindicated, can monitor any side effects, and can make changes to the prescription if necessary.
Commonly misused prescriptions. Stimulants prescribed by doctors to treat conditions like attention deficit hyperactivity disorder or ADHD. They work by increasing the levels of certain chemicals in the brain and body to increase alertness and concentration for people with ADHD. Some consequences of abuse are increased anxiety, blood pressure, heart rate, as well as constrict blood vessels, of which can be bad for a person's health in short and long terms. It can make it hard to sleep, which can lead to lack of focus and coordination, increasing the risk of injury.
Some common stimulants are Adderall, Ritalin, and Vyvanse. Some short-term effects are heightened awareness, increased heart rate, energy burst, unusual behavior, or jitters or restlessness. Potential long-term effects are tremors, insomnia, heart issues, and organ or brain damage.
Some commonly misused prescription drugs. Pain relievers. They are prescribed by doctors to relieve severe pain and physical discomfort, like for the pain in a broken leg, not just an everyday headache. They work by interrupting the pain signal so that people don't feel as much pain. Opioids are a commonly prescribed pain reliever. Opioids are a category of pain reliever. They include not only opioids derived from opium, but also synthetic narcotics that mimic opium.
Some common opioid pain relievers: Percocet, oxycodone, morphine, and Vicodin. Some short-term effects are drowsiness, constipation, slowed breath, and unconsciousness. Some potential long-term effects are physical dependent addiction, withdrawal symptoms, which can include pain, and tolerance building.
Commonly misused prescription drugs. Sedatives are prescribed by doctors to treat conditions like panic attacks, anxiety, and sleep disorders. They work by slowing down the mind and body to reduce anxiety and increase sleepiness. Some consequences of abuse: it can cause people to slur their speech, stagger around, and become uncoordinated.
Some common sedatives are Xanax, Klonopin, and Valium. Some short-term effects are slurred speech, poor coordination, and confusion. Some potential long-term effects are memory loss, short attention span, and quick changes in emotions.
Getting a grip on reality. Myth: it's safer to use prescription medications than street drugs like cocaine or heroin.
The reality is, prescription drug misuse can be just as dangerous as using street drugs.
A myth is that prescription drugs can make people feel good.
The reality of it is prescription drugs can make people feel better, but they can also make people feel terrible.
A myth is using someone else's prescription medications can help you get better grades in school.
But in reality, teens who use someone else's prescription drugs often have lower grades than those who do not.
Thank you for listening, guys. I hope you have a great day.